You are welcome to my channel. Today I'll be addressing cat bite and cat scratch. Cats could be nice and cute, but they can inadvertently kill you. Thousands of cases of scratches and bites have been reported each year. And guess what? From healthy-looking cats. In fact, there is an entity known as cat scratch disease. Epidemiologically, women are mostly affected. Why that? Women, might be probably more women keep cats than men, but more because women are more caring. They will be the one to feed the cat, to look after the cat, to cuddle the cat more than men would do. And while doing that, like I said earlier, inadvertently, the cat could scratch or could bite them. But 30 to 40% of those cat bites will end up in the hospital. 60% will need serious wound debridement, while about 25% will finally require plastic surgery. Some may not have any serious events, and the problem can last 2 to 12 months. Is it a serious condition? Of course, yes. It is serious. It is dangerous. So, don't ignore it at all. Act quickly by contacting your doctor, because 20 to 40% might die from cat bites. Why that? There might be cellulitis, might be sepsis, septicemic shock with multi-organ failure and death, all from cat bites or scratch. When there is cellulitis, there will be inflammatory process causing the lesion that will be rapidly spreading. The region will be swollen. You will see it that it will be red. When you feel it, it will be hot to touch. Very painful. You may or not be able to use that very limb. Why so dangerous then? If you check the teeth of the cat, you'll find out that they have very sharp and long teeth, the canis. The entry may be so tiny when they bite you, but the long and sharp pointed teeth will lead to a deep-seated bacteria, benin. Not so many other reasons why they are dangerous could be that they can cut deep into below the skin coverings, deep into the muscles and the joints. The deep-seated nature has afforded the bacteria and toxins to evade the immune system. Hence, they exert massive damage. And with time, there will be septicemia. Can we be careful about rabies? Yes, in some parts of the world. But generally speaking, the rate of rabies in cat bite or cat scratch is pretty low. But it is better to be careful. What are the signs and symptoms? All you may notice is a small skin cut, but there's going to be a deep wound inside. Within 24 to 48 hours, there will be inflammatory process with signs and symptoms and other systemic symptoms as well. There will be want, redness, pain, swelling, limitation of that very joint movement, and be smelling with pus or recurrent abscess. The systemic Symptoms will include fever, chills, headache, nausea, vomiting, loss of appetite, and sometimes there may be sore throat. Still on signs and symptoms, at the site of the bite, there might be blisters, or some called rashes. The lymph node along that region, draining that region, will become enlarged, lymphadenopathy. And some will present with fatigue, sepsis, septicemic shock, permanent deformity of the affected limb, or sometimes, if immediate intervention is not sought, there might be death. Okay, what are the organisms responsible for cat scratch, Bartonella, and hensellae? True cat flea. The name is Ctenocephalides felis. Also true Bartonella, clarridgeiae. The cat scratch is very common amongst kittens less than 1 year. How about cat bites? What is the name of organism or organisms involved? In this case, it's Polymicrobial. Both aerobic and anaerobic bacteria are involved. Capnocytophaga infections from cats or dogs is a possibility, but majorly we will be dealing with Aerobes here, like Pasteurella, multocida, subsp.multocida. That is the main organism. If you're a medical student, that is the main organism. But not the only bacteria involved. There's Pasteurella, multocida, subspecies septica, Pasteurella, canis, Streptococcus, Staphylococcus, Neisseria. The list goes on to include Enterococcus, Bacillus, Moraxella, Corynebacterium, and even some anaerobes like Fusobacterium, nucleatum. All could be involved in cat bite. Do we need to do any tests here? Yes, of course. You can have that one solved for microscopy, culture, and sensitivity test. You can have blood culture. Remember, I've said earlier, that might be septicemia. You can have X-ray drawn to know how deep it has gone if the bones have been affected. And patients who are rich or in some centers now with sophisticated equipment, you can have magnetic resonance imaging done. Treatment. First thing first, report to your doctor immediately. Then you can have first aid before reaching the clinic or the emergency room. Clean the wound and dry using dry cloth. You can use that dry cloth to apply pressure on the bleeding wound if you have one. On getting to the emergency room or your doctor's office, before it will refer you if there's need for that, there should be generous irrigation of the wound. You can use disinfectant like betadine, Epsom salt, peroxide, and sometimes use warm water. You may apply antibiotic ointment. Depending on the presentation, most of the times, generous wound debridement will be required. Then, can administer empirical antibiotics systemically. Then, review the laboratory results to be able to give specific antibiotics that the affected, or causative agent will be susceptible to. The empirical antibiotics you can choose from will include a beta-lactamase inhibitor like tazobactam or suiacin, that is piperacillin, tazobactam, clavulin, Septra, fluoroquinolones in people that are sensitive to penicillin. If you can't use clavulin, then you can use fluoroquinolones. You can also use Septra. Some people are sensitive to sulfonamide. So you see, you have different antibiotics to choose from. The second line is doxycycline, but please, note this, I'm not going to mislead you. Don't give doxycycline to any pregnant woman, and don't give doxycycline to a child less than 8 years. Actually, some literature review, they put it now that any child less than 10 years should not take doxycycline. Okay, let's put it, any child 8 to 10 or less than 8, don't give doxycycline. Then review the lab results later on and give specific antibiotics that the organism is susceptible to. And with that, I've come to the end of this short presentation as per cat bite and cat scratch. It might appear so minute, but it can take life. Don't joke with it. Act quickly. Thanks for listening. Remember to share this very presentation. Remember to subscribe to my channel so that you can get all my presentations immediately they're published. I appreciate it.